pleased that Carilion received a grant from the CDC and the Virginia Department of Health for antibiotic stewardship. It's such an important topic, and one that I think that we really do not have a lot of history with here in Southwest Virginia. It's not unusual, having been a physician and sometimes ordering antibiotics, to have patients come and ask for an antibiotic because they have a viral illness. And as we know, antibiotics are not going to treat that viral illness, and it may actually cause side effects for that patient. And in addition to that, it may ultimately end up with having antibiotic resistance, which of course will be terrible for all of us when we are actually having an infection that needs to be treated. This is such an important piece of work for Carilion, and I think that it's a partnership of the infectious disease department with our pharmacy, our physicians, our nurses, and importantly, our patients. Our patients need to understand the reason that we are not going to be treating viral illnesses with antibiotics, and that it's in their best interest. I appreciate this effort by Carilion and feel that it will be very good for not only our clinic, but also for Southwest Virginia.
So yeah, antimicrobial stewardship is just so key for what we are trying to accomplish, here at Carilion, as well as healthcare across the world. Things have changed. We have new science, new resources, new expert recommendations, and we need to be on top of that, both in the outpatient world and in the inpatient world. We have to be nimble and stay up to date with best practices and best recommendations. If we treat our outpatients with heart failure or type 2 diabetes like we did 10 or 15 years ago, almost by definition, we're doing it wrong. And I think a similar thing could be said about antimicrobial stewardship. We have new thoughts about who to treat and who not to treat. We have new medications available to us. We have new guidelines. We have new recommended durations of treatment that are often, much more abbreviated than we're accustomed to. And so, we as an organization are trying to do our very, very best to be the best stewards that we can be, really so we can align with our very just mission of taking excellent care of our patients. Our patients deserve and expect from us high quality, safe, high value care. And outpatient antimicrobial stewardship is absolutely aligned with all of those very important things that we strive to attend on a very consistent, very high level basis.